My name is Kim, and I'm an occupational therapist. I have been for 38 years. I live in Tennessee right now. This is my best buddy, Jen.
Good morning.
Where are you from, Jen?
I am from Michigan. I've moved around a lot, but I'm currently in Michigan. Also been an occupational therapist for 35 plus years. And Kim and I met at my first job, since Kim is considerably older than I am.
We met at University Hospitals of Cleveland a long time ago. But between the two of us, we are going to bring you 75 years of occupational therapy experience. Most of those in the pediatric arena. We have had the privilege of working with thousands of children with sensory processing disorder, with autism, with ADHD. We have great educational backgrounds. We've gone to many workshops. We've done a lot of experimentation and strategies to find out what are the best practices for our kids. We've learned so much from our parents, so much from our kids, and we're hoping to bring that information to you over a series of weeks and months on a variety of topics. We talk about sensory processing. It's across 8 different systems. Don't want to overwhelm you with those 8 today. We're going to talk about the tactile system today, but we acquire information from our senses, and then our body has to process that information. And most of the time that works out well. We're not overwhelmed by what we see, hear, feel, etc. But sometimes our kids are overwhelmed. And we want to talk about the tactile system today. What happens when kids are overwhelmed? What happens when they're hyposensitive to information and they don't feel it? Jen, do you want to add anything to that?
I guess what I want to add to that is that this is considered a neurological disorder, that it's not a cognitive or a mental disorder, that there are, sometimes we know the reasons why it happened. Maybe it happened because of prematurity, or maybe we had some kids that were drug addicted, but maybe it's just the way they are wired. And really it doesn't matter so much, but it does affect our kids and our families across the board in many, many areas of their lives. So we just want to provide you some strategies to make your life a little bit easier and help your kid be regulated, get regulated, stay regulated.
And when we talk about being regulated, that is such an important phrase that doesn't apply just to children. It applies to your teenagers. It applies to adults. It applies to senior citizens. It is, how do we respond? What is our emotional response to this incoming stimulation? And if our little 2-year-olds are hypersensitive to tactile stimulation and somebody brushes by them too much and they have a meltdown, they're not being a bad kid. They're not being a bratty kid. They're having a reaction to a stimulation that they see as excessive. So one of the very first things that we want to talk about is looking at your children in a different way, looking at their behaviors differently. We're going to ask you to be a detective, sort of a super sleuth in, all of a sudden my child is having a meltdown. My child is crying. My child doesn't want to go into the store. And instead of thinking that they're being bad, trying to figure out what could be happening. If you have found us, that tells me that you probably think that your child may have some sensory sensitivities going on. And so that'll be one of the first things that I want you to do. And I call that taking a sensory temperature. When I go to work, I see children in their homes, and I walk in their homes. The first thing I do is a sensory temperature. What is going on with that child? Are they calm? Are they attentive? Are they able to focus on me? Or is there something that's bothering them, that's preventing them from engaging and attending? And if it is, I try and figure out, first of all, biologically, did they sleep well? Did they eat well? Are they constipated? That can really affect a child's behavior. Once all of those things are ruled out, then I'm going to start looking at the sensory system and asking the families about, we have questionnaires that we can use, but just asking the families about, well, you know, I notice he doesn't have his shirt on. Does it bother him that the tags are itching the back of his neck? Does the shirt bother him? He's walking on his toes. Is he sensitive to the way it feels under his heels? What else would you have to say about that, Jen?
So my thought about this is sometimes parents don't even realize that these are problems because it may be their first child and they don't know any differently, that this is just the way they are. I just didn't think he liked his shirts, or I thought he was hot and he didn't want to wear a shirt, and they didn't think that it was odd and they didn't think that it was different.
Right.
So my little system is called my red flag system. And as soon as there's that little bubble in your head that is like, that seems a little bit weird, that's your red flag. And then we start delving into, we start doing the analysis of why this is happening. And if they're not doing something, why aren't they doing it? Is it age appropriate? And should they be doing it? And how do we get them to the point where they can do it? So if they're not wearing their shirt, or if they strip when they come home from school, or if they don't want to lay on their tummy, or if they are very sensitive to a certain nipple or a certain bottle, or we can't wean them, it's a red flag. And we need to delve a little bit deeper.
Right. Or if they tell you their child hates going to get their hair cut. They back off. You start to walk them into the salon and they start to back off, or they start to scream, or they don't like to have their hair combed. They hate to have their teeth brushed. They don't want to take a bath. They don't want shoes on. All of those things tell me that your child is probably hypersensitive to touch.
I don't want people to think, though, that you have to have all these things. It's like all of them or none of them. No, that's not the way it is. Mm-hmm. You could possibly be hypersensitive to having your hair cut, but be okay with socks. Or it doesn't have to be an all or none. It's not an all or none system. And every day and every minute of the day is a different moment in that day. So, for example, if you were in a car and you almost got into an accident and you were hyperventilating and your heart rate went up and you were a little bit sweaty because you were so scared, so you're in your fight or flight system, and it takes you a while to calm down, but you get down. For our kids, sometimes they are in that constant fight or flight. So as Kim was saying, if they have somebody that brushes against them, that shoots them up into that fight or flight system, and it's hard for them to get back down. And then something else might happen and they shoot up again and they start coming down and something else happens. So they're higher than they should be because they're not coming all the way down. That's a typical scenario for some of our kids.
And what I hear you saying is that they're almost in that fight or flight protective phase all day long because they're almost being assaulted from their environment. Everything comes in too strong for these hypersensitive kids, and they're scared. They're always kind of on guard. They're always, and sometimes they can come off a little aggressive when they're on guard like that. Absolutely. But I like that. You're right. They're not hypersensitive to everything. You'll find that there are some things. And to add on to what Jen is saying too, if that child is sick, if they're tired, if they're constipated, if they didn't eat well, just like us, if we don't eat, we can't handle life as well either. And some of those symptoms even get worse. So again, I want you to look at it as through a different lens. It's not bad behavior. It is their response to the environment. Other tactile sensitivities that we see are kids that don't like having their nails cut. They don't like having their toes cut.
Don't like having their hands dirty.
Hate having their hands dirty. Yeah, they might not do some crafts. Your other kids are sitting there playing Play-Doh. This child doesn't want to. Maybe they go to a playground, and there's a lot of reasons for this, but one of them is tactile sensitivity. They're kind of the kids on the periphery because they don't want to get their feet, that the sand looks kind of funny, or the mulch looks kind of funny, or the little rubber pellets look funny, or they don't like how the feel of the playground material is going to be.
Yep. And sometimes it's hard to tease out what's what. It might be a sensory or a tactile thing, but it might be a proprioceptive thing, or at that point they could maybe be perceiving tactile as pain. So it could be an emotional response, and they just don't even know what that feeling actually means. Right. So it's hard to tease it out, but we look at their behavior and we kind of try and figure it out from there. Like, how can we help them in this moment? What strategies do we have that can help them be more successful, help them to have friends, help them to participate in the gluing activity, or on the playground, or turn taking, on a swing. There are so many areas that it could affect them.
Mm-hmm. But you begin with observing and thinking of their behavior differently. Parents have said to us over years, I'm a parent of 3, I'm sure I've said the same thing, that all of a sudden a child might just erupt. They might throw something. And I ask the question, what do you think happened there? And the answer is nothing. He just did it out of nowhere. And then we have a conversation about behavior always is a response to something else. Sometimes we just don't know what it is. Most young children aren't bad kids. They're reacting to something. So it's looking again through a different lens and trying to figure out what happened beforehand. What did they feel in their bodies? And when we talk about the other sensory systems, what did they see? What did they hear that caused them to be overwhelmed and then to have a reaction? So we've been talking about hypersensitivities, Jen. Let's talk a little bit about kids on the other end of that spectrum, the hyposensitive kids.
So the hyposensitive kids might be the ones that are bumping into the walls or bumping into kids, and they don't even know it, or they don't feel it, or they'll come home with a bruise and you'll say what happened and they have no idea. Or they're the kids that are playing in the sandbox outside and literally they have buried their body into the sandbox. So they are completely covered and they don't want to leave. Both of the kids on either end of the spectrum of the hyper or hypo could have difficulty with transitions for similar reasons, in that they don't know how to interpret that data. They don't want to leave what they're doing because they're comfortable and they're not sure what the next scenario is going to look like.
Yeah. And some of those hyposensitive kids too, I find, are sensory cravers. That is even sort of a separate category for sensory modulation, but for today, we're just going to put that sort of in a similar category with our hyposensitive tactile kids. So they don't feel or interpret sensations like the rest of us do. I'm sitting at a chair, I can feel the chair underneath me. Some of these kids don't. So what do? You see them bouncing. They're trying to get more input. They're the kids that are constantly moving around, touching other materials because they can't feel it as strongly as the rest of us do. So they're trying to get more information in. Maybe they're pushing into their faces, they're pulling on their hair, they're kind of twirling their hair, they're banging their legs up and down. They're trying to get more information in order to feel normal. So those are our hyposensitive tactile kids.
Or they could be the gum chewers, or they could be the kids that love the sour candy, or even for adults, it could be a smoker, it could be a sensory seeker.
My two sons were sensory seekers, and I had to constantly buy big jars of jalapeno peppers. They put it on everything, scrambled eggs, sandwiches, you name it, they put it on there. So, but now we'll go ahead and talk about some strategies. We'll swing back to the tactily hypersensitive kids, because I think that's what we usually see.
Right.
And throw some suggestions out there.
So I guess I want to make sure that you understand that OTs really have a strong background in this sensory piece, and that you really, my recommendation is that you seek some help if you have a lot of questions in this area, that you seek some help. Because one of the strategies is a brushing protocol, a Will Barger brushing protocol, and that really needs to be done with a trained therapist.
So we're going to continue talking about hypersensitive strategies for the child with tactile challenges. Jennifer is going to start talking about strategies for babies.
Yeah, so oftentimes with babies, we see the babies as hypersensitive. For example, they might not like to be on their tummy because they have so much information on their belly or on their hands or on their face. But tummy time is hugely important for development, for shoulder girdle strength, for ocular, for eye movement, for head control, the whole vestibular system that we'll talk about later on. But an average 4-month-old spends 80 minutes a day on their belly. And that gives them so much information and so much strength and ability to move on to higher levels of development, so that they can crawl and really get the shoulder girdle strength necessary for fine motor skills. So oftentimes we also have fussy babies that are difficult to calm down. They might need swaddling, and you might feel like you're swaddling them so tight, but that's the only way to calm their little system down. So infant massage would be another technique that we could use to help keep that system calm, to get them in that quiet, alert state. Babies are pretty easy to read. So they're either hungry, they're tired, they're wet or dirty, and the rest of the time they're sleeping as infants. So if that is not the case, then I think that we need to put some strategies into place so that everyone can be happier. Sometimes these hypersensitive kids have difficulty latching on to different nipples, or parents will describe them as they suck for a couple of seconds and then they stop. So we have lots of ideas, and there are lots of, thank goodness now that there are lots of different nipples that we could use or try. There are some that are easier for these kinds of babies to latch onto. So those are some strategies for the babies. I guess maybe it makes sense to move on to the toddlers or walkers.
Yeah, I was going to say a couple more things about the babies. You know, over the decades, because we've been doing this for decades, kids have become a little bit more resistant to being placed on their stomachs because of the sleep on the back program to reduce SIDS, sudden infant death syndrome, which has been very, very effective. But we have found that kids get really fussy and don't want to be put on their belly. So we need to be a little insistent about that during the daytime when they're awake, because that does help desensitize the front of the body. And it's so important that they get up on hands and knees. They rock back and forth and they crawl, because that will desensitize the hands and the feet and the knees going forward. So we want to make sure that we don't miss that phase.
Yeah. So the other thing I thought of actually was the amount of input that a typical baby gets when they start feeding, when they start getting their hands in the food and putting non-food items in their mouth. They're getting so much tactile information in their hands and in their mouth. And that is super important for later on holding a pencil, being able to put your hand in your purse and figure out that you have a quarter. All of those foundation skills are laid as a baby.
And we want them to be messy. I know some of our families haven't been always super happy about our kids feeding themselves because it ends up all over the face and all over the floor. But if they miss that developmental opportunity of exploring all those different textures, sometimes they become picky eaters. So we don't want to not allow them to have that opportunity.
Good point.
So I think we're going to talk about strategies for toddlers now.
Yep. You want to start? You want me to?
Go ahead.
Okay. So toddlers, we've already talked a little bit about how important that crawling stage is so that they can get that good input into those large muscle joints. And then when they move up into standing, they're also getting that input into their legs. And when they fall forward to catch themselves, they get all that jolting into their shoulder. So I have had some kids that have been so tactily defensive that they never went through the crawling stage, and unfortunately did not catch themselves when they were falling and really caused some harm to their face. They hurt themselves. So it's super, super, super important that they go through that stage and really have good, strong shoulder girdle muscles. So we talked a little bit about the eating, but toddlers love to help in the kitchen, whether it's with their pretend food or with real food. Putting first because it's pretty immediate. It takes 5 minutes, stir, add the milk, pour, you get a little science in there, you get the good shoulder strength from stirring, making cookies, getting their hands in there. This is a great age to go outside and walk in the grass and to pick those dandelions and to get all of that sensory input into their hands. Bath time is another great time, natural time to play in with tactile. You can put shaving cream in the bathtub. You could put, just obviously water, colored water. There's so many different bath experiences now.
And some of my kids maybe took baths when they were younger, and when they got older and they were able to tell their parents that they didn't like the water, they started having a fit before bath time. So what I have the families do is stand them at the sink and have them play with toys in the sink so that their entire body is not submerged, and they get used to it a little bit that way. And then I take those toys and have them play over the side of the bathtub where their hands are just in the water, and eventually they go ahead and they're receptive to getting back into the bath. And going back to the cooking, kids as young as 18 months love to cook. And if they are picky eaters, which sometimes our kids with tactile sensitivity are, just being around the smells in the kitchen and the different textures in the kitchen and the different colors in the kitchen with makes them a little bit more receptive to trying the things that they helped make. I never forced that on them. If they assisted making cookies and they don't want to eat the cookie, I don't make them eat the cookie, but just having them exposed to all of those different sensations during the cooking process is a great way for you to decrease some of the tactile sensitivities.
There are some studies out there that say that you need to present food to kids. I think it's 25 times before they even put it in their mouth. So they need to look at the broccoli on their plate 25 times before they even get it in their mouth, just so they know that it's not so scary. So all that modeling is really, really good. And it's hard for those parents that are not so thrilled about being messy. So you really need to be a good role model and kind of bite your tongue and get your hands in there and do that, plant some flowers, dig in the dirt.
They love that. And you were talking about taking nature walks outside. I like to give the kids a little basket and have them pick up everything they see, because things are rough, things are crunchy, things are slimy that you find outside. And it's just more opportunities to give them some tactile exposure.
Absolutely. Absolutely. Move on to preschoolers.
Yeah, I wanted to say one more thing about the toddlers. A lot of the kids are really sensitive to having their hair brushed, their teeth brushed, hair washed. Vibration is sometimes a great way to get beyond that. I'll give them a vibrating toothbrush. I won't brush their teeth. I want them to be in control of it at first. I'll give them the toothbrush and just guide their hands up to maybe their cheek using the back of that vibrating toothbrush, cross their lips, and then eventually into their mouth. There are vibrating hairbrushes that you can buy. You can get those little, what are they called, Jen? Those little metal things that you
The little massagers, the head massagers.
Yeah, and the kids love those, which is a great way to sort of massage the head before you comb the hair. Sometimes that's a great way to desensitize the head and face before you comb their hair and wash their hair as well.
Yeah. That's a great idea. And actually, even earlier on, I have families. I actually talked to one today about a baby, a 1-year-old, who is very sensitive in the mouth. And we talked about getting one of those finger cots that have like the little bumps on them, so that she can get their hand in there, in the baby's mouth to brush the gums. So honestly, the earlier that you do this, the better off you are. The more exposure, the more experience, the more trials that they have.
Exactly.
Yeah. Preschoolers. All right. So some of my ideas with preschoolers are, one of my favorite ideas are sensory bins. I am like a perfect OT because I love sensory input. I love the hiding things in rice and flour and slime, and I love Play-Doh and cooked spaghetti and raw spaghetti and the noodles that you can, rigatonis that you can put on your fingers. There are tons and tons. Kinetic sand. Glue is a really good sensory experience for if you did like little craft things with your kids where they had some leaves and they had to glue them on the paper. No right way to do it, no wrong way to do it. We're just doing it for the exposure. Cooking activities are great with these kids. I love cooking with preschoolers. Spreading, because inevitably they're going to get whatever on their hands. Cracking an egg, super fun.
And get the whole family doing it, because a lot of times if they see dad doing it, or they see their brother doing it, or they see the friend next door doing it, they might just sit back and watch a little bit. But when they see how everybody's laughing and having fun, they may join in.
Yeah. So some other ideas for preschoolers that I like a lot are heavy work. So like pushing a stroller, or in the grocery store, they have the little kid carts. And the heavier the better, because it gives lots of that strong proprioceptive joint information so that they get a better sense of where their body is in space. The blanket rolls are really fun.
When Jen talks about proprioception, and hopefully you'll stay with us for other videos, so hopefully you subscribe and we see you again. But proprioception is input from your muscles, ligaments, and joints. And it is a calming input. So those of us that are stressed out and like to run or like to go to gym or like to hike in the woods, like to lift weights, like to do yoga, those are all forms of proprioceptive input that are calming. We use those same strategies for our children. It's just different ways. They're not pumping iron, but they're submerging their hands into some heavy sand or a heavy bin of beans and all the other strategies that Jen has been talking about.
Another one of my favorite preschool activities are the body socks. So it is like it's made out of neoprene, and you zip your entire body in there so that they can push their muscles against it. And kids that need their own little space or want to be in their own little cocoon, this is a great way to help them calm down. We've made little tents for the kids, little forts for the kids, to get them in a spot where they can feel cozy and comfortable. Tight hugs, obviously, are always welcomed. But you know your child, so you know what helps them calm down. And the tactile system is huge. Lotion is a great technique. Give firm pressure. Make sure that you are not doing light touch. Although some parents report that kids like light touch, go for it. But in general, firm pressure really gives information about where their body is. They're not wondering where your hand's going next.
If you have a child that is out at the grocery store and they're getting overwhelmed, maybe they're overwhelmed by more than just tactile input, you can have a sensory bag that has heavy pressure items in it. Squeezy balls, for example, little bands that they have to pull. Any kind of proprioceptive item will be calming to your child if something has, if they're having that hypersensitivity reaction to something.
Mm-hmm. Yep.
Yoga for kids is also a very good thing. I've done it with 2.5-year-olds. You can find YouTube's Yoga for Kids. There are yoga cards. Kids love to do that. Deep breathing is a proprioceptive activity. I'll put the kids right on my lap and do some deep breathing, and they feel that, and that relaxes them as well. So I'm really looking forward to the video we do on proprioception, because that's a game changer for our kids with hypersensitivity. Yeah. So we'll go. Did you have something you wanted to add to that?
I was just to say, going back to the deep breathing that you're doing and putting them in your lap, what came to my mind is, if you are having one of those days where you are pulled in a million directions and you have work on your mind and you have to go to the grocery store and you have a phone call you need to make and you didn't get a good night's sleep, it's difficult for you to be on top of your game and to help your child because you're not feeling it. So my advice to you is to get yourself in that moment, to do some mindfulness or to do some yoga, to do some breathing, so that you can be in the moment, so that you can be calm, because your kid is a sponge and feeding off of you.
That is such an important comment that Jen just made, because I think we underestimate the power of our disposition or the energy that we're putting out there and its effect on our children. But they are little emotional sponges, and they will take in whatever energy you're putting out. So if they are really having a meltdown, we can help control that just by changing our energy level and our demeanor, our breath rate, everything about ourselves. It's hard to do, but it's so vital.
Definitely worth it. It'll pay off dividends. Yeah.
Absolutely.
Yep. So another thought that I had was that sometimes my parents I'll give some advice and I'll say, hey, try this. And I'll come back a week later, hey, how'd it go? And they're like, yeah, we tried and it didn't work. So when I delve in deeper, they tried it once. It might've been a bad day. The kid didn't like it. Well, the kid didn't like it probably because it was new, or the child didn't like it because it took them out of their comfort zone. So there are not many things that we can do that we do once and we're good at. So my advice is to practice. Kids love repetition. Do it again and again and again and see if it works. And maybe you do need to tweak it. Maybe you need to roll them in a blanket a little less tight or more tight, or maybe you need to hold them longer, or Maybe you need to watch their face for their facial cues. They're telling you what they need. We just need to get better, to be better at reading them. And it just takes practice on both parts, on the kid's part and on the parent's part.
Absolutely. So we're going to swing and talk about our kids on the other spectrum, our hyposensitive kids. And that's interesting. And a lot of times those kids don't end up in our clinic because their behaviors aren't quite as obvious or challenging as our kids that have some hypersensitive issues. But the buzzword for these kids is when a parent of a 3-year-old or 4-year-old says, oh, they're just lazy. They don't want to do anything. They just want to lay on the floor. Well, we're here to tell you that 3-year-olds aren't lazy. 4-year-olds aren't lazy. If they're just laying on the floor, there's a reason to that. And if they are hyposensitive to input, they're just not feeling things. They're not feeling their world. They need to be stimulated. So it's very different extreme than our kids with the hypersensitivity. We have to increase their arousal level. Now, a lot of those kids that are hyposensitive also have low muscle tone. We'll talk about that in another video. Because all of these things go hand in hand. But those kids that are described as just lazy, we want to bounce them on Pilates balls. We want to get them on mini trampolines. If they're allowed to jump on a piece of furniture in the house, if they're allowed to, that is fine. They're going to get stimulation into their feet. They get vestibular by moving up and down. Some people will allow their kids to go onto a crash pad that's on the floor. They jump on the couch, then onto the crash pad. Singing, dancing, lots and lots of activity. A lot of loud music, talking a bit louder to them, just a lot of personality when you're communicating with them. We're giving those kids input as opposed to the kids that we're trying to remove input from. And you might have to do that several times a day, and we call that a sensory diet. You're going to hear that where maybe throughout the day when you get a chance, everybody's jumping for 15 minutes, everybody's dancing for 10 minutes. You may find that child's energy level is up for a while and then it starts to lower later on in the day. Then you do some more exciting activities to get their arousal up again.
Yeah, so playgrounds are great for these kids. Climbing up a slide and coming down and slamming your feet, you know, at the end of the slide. Or like a lot of our kids on the end who we want to calm, we want to do that slow rhythmical swinging. For these kids, we want to put them on the tire swing and swing them around and stop them really fast and then start them again and stop them fast. So we want to really give them tons and tons of input. The dads, this is where those dads come in with that roughhouse play where they are just doing things that we are either don't have the strength to do or the courage to do, but they need it. These kids need it desperately.
Exactly.
Yeah.
And then lastly, we'll talk about our sensory cravers who are just always getting their hands into things because they need that extra input. And the best way to deal with those children is to give them multisensory input. As Jen alluded to earlier, they're the kids that go down the slide, but maybe you put shaving cream on it. Maybe at the end of the slide, maybe they don't have their shoes on. At the end of the slide, they're going down into the mulch so that they can feel the input then. Lots of proprioceptive input with them, jumping, running. If you have the bin of beans, you have items in there that they've got to pull out. So it's a lot of multisensory input with these children.
Yeah.
Any other thoughts on?
No, just to increase, so the kids are already telling us what they need and that we can increase the intensity or the frequency or the duration. So for those kids that like do ring around the rosy and then fall down, we can do ring around the rosy faster, and we can make them fall down onto a cushion harder, not to hurt them obviously, but just to give them more input than they're currently giving themselves. And hopefully as they get more input, they crave less input because they're getting what they need, so they're not constantly seeking it.
And you know, the proprioceptive input will also address the needs of the tactile sensory seekers. So you don't have to think of it always as what can I give my child in their hands. It can be playground time in the backyard or running, taking a jog around the neighborhood with them. So it's not always input that they give to their hands. Yeah. Well, we hope we
I was going to say, or setting up an obstacle course in the house would be great. But wait, before we leave, I don't want to leave yet. I have one piece of advice for you that is super important for all of this, is to read your child and wait. Wait for their response and wait for them to tell you what they need and what they like and what they don't like. And Kim alluded to this earlier, that you have to be super sleuth-like. So you are really doing a whole lot of reading into what they need, what they like, what they don't like. And that will make everybody's life more successful. And my last piece of advice, I know I'm kind of verbose, give choices. Kids like to have control, and kids know what their body needs more than we know what their body needs. And if we give them a choice, do you want to swing on a swing or go on the slide? They will pick what their body needs.
Exactly. And one more thought I had that when you were talking is give yourself a break, because you're going to be changing yourself, and you're going to notice days that it works beautifully and you're going to feel really good. But maybe the next day, it's not going to be so good. So it's baby steps. Small changes will end up to be bigger changes. So thank you for joining us. We're going to be putting out more sensory videos. We hope you hit subscribe, and we hope to see you again soon.
You got this. Good luck.
Thank you.